1 in every 3 adults has high cholesterol, and most don't even know it until it's too late. Could your lab test be warning you already? Hey everyone, and welcome today. We're diving deep into a topic that affects millions, often silently high cholesterol. It's one of those things you hear about, maybe even see on a food label, but do you truly understand what it means for your health? We're going to break it all down, from what cholesterol actually is and why your body needs it, to the sneaky ways it can build up, and the serious health problems it can cause if left unchecked. In this video, we're not just going to skim the surface. We'll explore the different types of cholesterol, the good, the bad, and the triglycerides, and what those numbers on your lab report actually mean. We'll uncover the common culprits behind high cholesterol, from diet and lifestyle choices to genetics. And most importantly, we'll discuss the symptoms, or lack thereof, how it's diagnosed, and the real-world health risks you could be facing. But don't worry, it's not all doom and gloom. We'll also arm you with powerful prevention tips and dietary changes you can start making today to manage your cholesterol and protect your heart. My goal here is to empower you with knowledge so you can have informed conversations with your doctor and take proactive steps for a healthier life. Understanding your body is the first step to taking control of your well-being. So, if you're ready to get smart about cholesterol and learn how to keep this silent threat in check, you're in the right place. Make sure you hit that subscribe button and the notification bell so you don't miss out on more health insights like this. Let's get into it. Alright, let's start with the basics. What exactly is cholesterol? You hear the word thrown around a lot, often with a negative connotation, but here's the deal. Cholesterol itself isn't inherently bad. In fact, it's a waxy, fat-like substance that's essential for your body to function properly. Think of it as a crucial building block. Your liver produces most of the cholesterol you need, and it's also found in some foods, specifically animal products like meat, eggs, and dairy. Your body uses cholesterol to make hormones like estrogen and testosterone, to produce vitamin D, and to build healthy cells. It's also a key component of bile, which helps you digest fats. So, you see, we actually need it to survive and thrive. The problems arise when we have too much of it, or an imbalance of the different types. Now, when we talk about cholesterol in your blood, it's transported by proteins. These combinations of cholesterol and proteins are called lipoproteins. You've probably heard of HDL and LDL cholesterol, often dubbed the good and bad cholesterol, respectively. LDL stands for low-density lipoprotein. This is the bad guy because if you have too much LDL cholesterol circulating in your blood, it can slowly build up in the walls of your arteries, making them narrower and less flexible. This process is called atherosclerosis, and it's a major risk factor for heart disease and stroke. Think of LDL as the delivery truck that sometimes drops too much cargo in the wrong places, causing blockages. On the other hand, HDL, or high-density lipoprotein, is considered the good cholesterol. Its job is to act like a scavenger, picking up excess cholesterol from your arteries and transporting it back to your liver, where it can be broken down and removed from the body. So, higher levels of HDL are generally protective against heart disease. Then there are triglycerides, which are another type of fat found in your blood. Your body converts any calories it doesn't need to use right away into triglycerides, which are then stored in your fat cells. Regularly eating more calories than you burn, particularly from high-carbohydrate foods, can lead to high triglyceride levels, which also contribute to the risk of heart disease, especially when combined with high LDL or low HDL. So if our bodies make cholesterol and need it, why do so many people end up with high cholesterol? Well, it's often a combination of factors, and understanding these can be the first step towards prevention or management. One of the biggest players, unsurprisingly, is your diet. Consuming too much saturated fat, found in foods like red meat, butter, cheese, and many processed snacks, can signal your liver to produce more LDL cholesterol. Then there are trans fats, often lurking in fried foods, baked goods, and margarines. These are particularly nasty because they not only raise your LDL, bad cholesterol, but can also lower your HDL, good cholesterol, a double whammy for your arteries. It's incredibly important to read food labels and be mindful of these fats. Beyond diet, a sedentary lifestyle plays a significant role. Regular physical activity helps boost your HDL cholesterol levels, that good artery-clearing kind. When you're not active enough, your HDL can drop, and your LDL might creep up. It doesn't mean you need to become a marathon runner overnight, but consistent, moderate exercise makes a real difference. Smoking is another major culprit. The chemicals in cigarette smoke damage the walls of your blood vessels, making them more prone to accumulating fatty deposits, a process called atherosclerosis. Smoking also lowers HDL cholesterol, and while moderate alcohol consumption might have some very limited heart benefits for some, excessive alcohol intake can increase your triglyceride levels and contribute to weight gain, both of which can negatively impact your overall cholesterol profile and heart health. Finally, some factors are less about lifestyle and more about your individual makeup and circumstances. Genetics can predispose some people to high cholesterol. A condition called familial hypercholesterolemia means your body naturally produces too much LDL or doesn't clear it effectively, regardless of how healthy your lifestyle is. Age is another factor. As we get older, our cholesterol levels tend to rise. Certain underlying medical conditions like hypothyroidism, diabetes, kidney disease, and liver disease can also affect your cholesterol levels. This is why it's crucial to have regular checkups with your doctor, who can assess all these contributing factors and give you a complete picture of your risk. Now, this is one of the most critical things I want you to take away from this video. High cholesterol is often called a silent killer, and for a very good reason. In most cases, it doesn't cause any noticeable symptoms, especially in the early stages. You could be walking around with dangerously high cholesterol levels and feel perfectly fine. There are no telltale aches, no specific pains, no outward signs that your arteries are slowly clogging up. This is precisely why it often goes undetected for years, allowing damage to accumulate silently until a serious event, like a heart attack or stroke, occurs. It's a sneaky condition, and that's what makes it so dangerous. Because it's asymptomatic for so long, many people only find out they have high cholesterol during a routine blood test, or unfortunately, after they've already developed complications. In some advanced cases, when atherosclerosis has significantly narrowed the arteries, some indirect symptoms might start to appear. For instance, if the arteries supplying blood to your heart, the coronary arteries, are affected, you might experience chest pain or discomfort, known as angina, particularly during physical exertion or stress. If arteries supplying the brain are narrowed, it could lead to symptoms like dizziness, confusion, or even a transient ischemic attack, which is like a mini-stroke. Other late-appearing signs, though less common and often indicative of very high levels or genetic conditions, can include xanthomas, which are yellowish fatty deposits under the skin, often around the eyelids, elbows, knees, or tendons. Some people might experience fatigue or shortness of breath if their heart isn't getting enough oxygen-rich blood due to blocked arteries. However, relying on these symptoms to appear is a risky gamble. The absolute best way to know your cholesterol status is through regular screening with a simple blood test. This proactive approach is key to catching high cholesterol early, before it leads to irreversible damage or a life-threatening emergency. Don't wait for symptoms. They might arrive too late. Okay, so you've had your blood test. What's next? You get a lab report and it's filled with numbers and abbreviations that can look like a foreign language. Let's break down what those key values mean when it comes to your cholesterol. The main test is called a lipid panel or lipid profile, and it typically measures 4 key things: total cholesterol, LDL cholesterol, HDL cholesterol, and triglycerides. Total cholesterol is, as the name suggests, the overall amount of cholesterol in your blood, combining LDL, HDL, and other lipid components. While it gives a general idea, it's really the breakdown of the types that gives us the most useful information for assessing your risk. LDL cholesterol, our bad cholesterol, is a primary target for management. For most adults, an optimal LDL level is generally considered to be below 100 milligrams per deciliter. Levels between 100 and 129 milligrams per deciliter are near optimal or above optimal. 130 to 159 is borderline high, 160 to 189 is high, and 190 and above is considered very high. The higher your LDL, the greater your risk of heart disease. Your doctor will consider your individual risk factors, like family history, smoking, and other conditions, when determining your target LDL level. It's not always a one-size-fits-all number, so a personalized discussion is key. Then we have HDL cholesterol, the good kind. With HDL, higher is better. An HDL level of 60 milligrams per deciliter or higher is considered protective against heart disease. Conversely, an HDL level below 40 milligrams per deciliter for men and below 50 for women is considered a risk factor. Finally, triglycerides. As we discussed, these are another type of fat. A normal triglyceride level is less than 150 milligrams per deciliter. Borderline high is 150 to 199, high is 200 to 499, and very high is 500 or above. High triglycerides often accompany high LDL or low HDL and are frequently seen in people with type 2 diabetes or metabolic syndrome. Looking at these numbers together gives your doctor a comprehensive view. For example, if your report shows total cholesterol of 245, LDL of 170, HDL of 35, and triglycerides of 200, this profile would indicate a significantly increased risk, and your doctor would definitely discuss intervention strategies. So, we know high cholesterol is bad, but what exactly are the health consequences we're trying to avoid? The primary danger, as we've touched upon, is atherosclerosis. This is the slow, progressive hardening and narrowing of your arteries due to the buildup of plaque, a sticky mixture of cholesterol, fat, calcium, and other substances. Think of your arteries like flexible pipes that carry blood throughout your body. Atherosclerosis makes these pipes stiff and clogged, reducing blood flow to vital organs. This process can happen in any artery, but it's particularly dangerous when it affects the arteries supplying the heart, brain, or limbs. It's a silent process that can take years, even decades, to cause noticeable problems. When atherosclerosis affects the coronary arteries, which supply blood to your heart muscle, it can lead to coronary artery disease, or CAD. If a plaque ruptures, a blood clot can form and completely block the artery, cutting off blood supply to a part of the heart. This is a heart attack, or myocardial infarction. Depending on how much of the heart is damaged, a heart attack can be fatal or cause long-term heart problems like heart failure. Similarly, if atherosclerosis affects the arteries leading to your brain, or within the brain itself, a blockage can cause a stroke. A stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients, causing brain cells to die within minutes. This can lead to permanent disability or death. Beyond heart attacks and strokes, high cholesterol can contribute to other serious health issues. Peripheral artery disease, or PAD, occurs when plaque builds up in the arteries that carry blood to your legs, arms, and pelvis. This can cause pain, numbness, and in severe cases, lead to infections or even amputation. Very high triglyceride levels can also cause an acute inflammation of the pancreas, known as pancreatitis, which is a painful and potentially life-threatening condition. Furthermore, high cholesterol is often linked with other conditions like diabetes and high blood pressure, creating a dangerous combination that significantly multiplies your overall cardiovascular risk. Understanding these potential domino effects really underscores why managing cholesterol is so vital for long-term health. The good news is that there's a lot you can do to prevent or manage high cholesterol. Lifestyle changes are incredibly powerful. Let's start with diet. One of the best things you can do is incorporate more soluble fiber into your meals. Foods like oats, barley apples, citrus fruits and legumes, that's beans, lentils, chickpeas, contain soluble fiber, which can bind to cholesterol in your digestive system and drag it out of the body before it gets into circulation, effectively lowering LDL. Healthy fats are also your friends. Monounsaturated fats, found in olive oil, avocados, and nuts like almonds and walnuts, can help lower LDL and maintain HDL. Polyunsaturated fats, especially omega-3 fatty acids found in fatty fish like salmon mackerel and sardines, can lower triglycerides and have other heart benefits. Aim for at least 2 servings of fatty fish per week. On the flip side, there are foods you'll want to limit or avoid. As we discussed, saturated fats found in red meat, processed meats, butter, full-fat dairy, and especially trans fats, which are often in fried foods, commercial baked goods, and some margarines, are major culprits in raising LDL cholesterol. Reading labels is key here. Look for partially hydrogenated oils as a sign of trans fats. Reducing your intake of sugary drinks and refined carbohydrates can also help lower triglycerides and improve your overall metabolic health. Focus on whole, unprocessed foods as much as possible. Think colorful fruits and vegetables, whole grains, lean proteins, and healthy fats. Small, consistent changes to your eating habits can make a big impact over time. Beyond diet, regular physical activity is crucial. Aim for at least 150 minutes of moderate intensity aerobic exercise like brisk walking, cycling, or swimming per week. Exercise helps raise HDL cholesterol, lower LDL and triglycerides, and manage weight. Speaking of weight, maintaining a healthy weight is important, as being overweight or obese can contribute to higher cholesterol levels. Staying hydrated by drinking plenty of water is also beneficial for overall health. And of course, if you smoke, quitting is one of the most impactful steps you can take for your cholesterol and heart health. Finally, if lifestyle changes aren't enough to get your cholesterol into a healthy range, or if your risk is very high due to genetics or other conditions, don't hesitate to talk to your doctor. They can discuss medication options like statins, which can be very effective in lowering cholesterol and reducing cardiovascular risk. All right, everyone, we've covered a lot today about high cholesterol, what it is, what causes it, the silent dangers it poses, and most importantly, how you can take control. The key takeaways are that cholesterol is essential, but too much of the bad LDL cholesterol or triglycerides, or too little of the good HDL cholesterol can lead to serious problems like heart attacks and strokes. Remember, high cholesterol often has no symptoms, so understanding your numbers through regular blood tests is absolutely critical for early detection and prevention. I really want to encourage you to be proactive about your health. Schedule those regular checkups with your doctor, get your lab tests done, and don't be afraid to ask questions about your results and what they mean for you. Knowledge is power, and understanding your cholesterol levels is a huge step towards protecting your long-term well-being. Diet, exercise, and avoiding smoking are powerful tools in your arsenal, but sometimes medication is also necessary, and that's okay. The goal is to work with your healthcare provider to create the best plan for your individual needs. I hope this video has demystified high cholesterol for you and given you some actionable insights. What are your experiences with managing cholesterol? Do you have any questions that weren't covered? Please share your thoughts and questions in the comments below. Let's learn from each other. And if you found this video helpful, please give it a thumbs up, subscribe for more health content, and share it with someone you care about who might benefit from this information. Stay healthy, stay informed, and I'll see you in the next video.